The targeted therapies have irrevocably transformed the therapeutic landscape, at least for those with oncogenic drivers. So EGFR mutant patients, in the past we would have given them chemotherapy alone or chemo plus bevacizumab. Response rates were about 30%, progression-free survival at best 6 months. Overall survival, medians 12 months, 14 months. Now with the advent of erlotinib, gefitinib, afatinib, and most recently osimertinib, response rates are 70%. Progression-free survival with osimertinib is nearly 19 months. And median survival in many of these studies has not been reached at 3, even 4 years. In fact, the median survival overall of this population is clearly north of 4 years. In some studies, it looks like it'll be about 5 years. And remember, we are seeing some long-term survivors. I don't fool myself for a moment that they're cured, but as long as they seem to stay on therapy, sometimes at reduced doses, they're doing well. We've seen even more astounding success with ALK. ALK translocations, it's a smaller proportion, unlike EGFR, which is about 10 to 15% ALK, seen in perhaps 3 to 8% of advanced non-small cell non-squames, but the drugs work exceedingly well. Alectinib and brigatinib are now the frontline agents of choice with response rates, again, 75%. Progression-free survival, at least in the ALEX trial, is about 3 years. We've never seen that before. We were happy to see survivors at 3 years. This is a median progression-free survival of 3 years. And then overall survival, at least in ALK and probably ROS1 as well, it looks to be about 6, even 7 years.